Okay. How will your party maintain health care while trying to manage the provincial budget? Well, with respect to health care, it's not only what we've done, it's what we intend to do. And what we're calling for is a new 10-year health accord. First of all, we need a federal government delivering on their word for strong funding commitments. Second, we need a federal government leading a national discussion on how we can strengthen Medicare for the future. And finally, those discussions must lead to a new 10-year health accord, negotiated among provinces and territories with priorities, accountability, and clear goals. Ontario has always been a leader. We went through some tough economic times, and Ontario was leading the way. And health care is a priority. Thank you.
Here, here, here.
I would say that with regard to health care, this is probably the program that has experienced the most chaos in this province. And that chaos is at least 20 years old. I will acknowledge that the NDP government initiated some of the changes that helped derail the system. In fact, since 1990, 18,500 hospital beds have been closed in this province. Now, when you think that everybody who's in a hospital doesn't necessarily need to be in the hospital to be treated, you might say, well, that's fine. But successive governments have not gone so far as to make sure that the community supports that were to receive people who were locked out of hospitals could get, so they can become well in the community. We haven't built the infrastructure that would help us relieve the hospitals to the extent that they have been relieved. And so what we have is a shambles. People can't get into hospitals, they can't get long-term care, they can't get home care. We promise 1 million more hours over 4 years devoted to home care. And every person who's treated in home care rather than in a hospital saves the system $20,000. So this is based not on heart, but on sound economics. The NDP government will restore the healthcare system to the health it needs in order to help us maintain our health.
A Tim Hudak PC government will put the patient at the center of the healthcare system. Right now, the size and scope of our healthcare system obscures the most important person, the patient. Current care is structured around forms, processes, long lines, and bureaucracy, when it should be built from the patient out. This is true when it comes to emergencies, chronic diseases like cancer and diabetes, and for people with mental health care issues who are too often lost in the system. We will introduce a series of patient-centered reforms that make the patient, not the bureaucracies, not the administrators, the focus of our healthcare systems. For all of us, we will grow our healthcare investments by more than $6 billion by the end of our first term. We will introduce rigorous system of patient satisfaction and health outcome measures to ensure patients have a clearer idea of what to expect and to give the healthcare providers a much clearer idea of what needs to be improved. We will establish wait time guarantees for emergency room visits, making hospital CEOs responsible for them, improving care for seniors with 40,000 long-term beds to allow for shorter wait times to receive appropriate and comfortable care while freeing up critical hospital beds. We will increase investments in home care and give families more control over the services that bring more doctors to communities that need them. We have priced out our programs based on current government projections and require a mere 2% to put our plan in place. When spending has increased 77% in adult McGuinness's government, a 2% target is a very moderate goal.
And this is, when we're talking about healthcare, and this is just going off the top of my head, when we go from one end of the riding to the other, a new health center in Lancaster, the hospital in Cornwall, the health center at the corner of 4th and Pitt, St. Joseph's Villa, the hospice, the new hospital in Winchester, with respect to how, and this is just in recent history. Now, if I'm making any mistake on that, feel free to challenge me. This is when we're talking about, you talked about individuals and how healthcare affects individuals directly. Drive around and check any of those things out for yourself. I mean, that's right across the entire riding. When you need to talk about, or you want to talk about what the Dalton McGuinty government, what Jim Burnell has done, What the Ontario Liberals have done, just go from one end of the riding to the other, and it's right there for you to see with respect to health care.
I have to challenge both my colleagues on the
Really?
statements on healthcare. I'd have to say that healthcare, I think everybody will acknowledge, is rationed. And nobody minds doing it out on a temporary basis or for a short while. But when the rationing seems to be permanent and seems to become more acute with every year, then the situation's intolerable. And as far as the Conservative plan, I think you said you're going to invest $6 billion more in healthcare. All the promises in the world have to be based on spending. Where will you get that money? How will your tax cuts help you do that investment in healthcare? I have to say, I think maybe you're deluded because I don't think you're dishonest.
Our plan has been well priced out, and those numbers are available. Anybody that cares to visit the website to look at them. Our point is you can spend all kind of money on shelves of building. You have to change the system. You have to get more doctors. You have to have a system that actually is able to accept patients and puts them through a process that allows them to get sick. I think my colleague to the right is very, very clear on the point and very right. Healthcare is rationed in this province, and it's restricted on how fast you get it, and when you need it fast, it's not there. And sometimes by the time you get it, it's too late.
Mark, there's a $14 billion hole in the Conservative Party platform. It leads to deep cuts. When they talk about the bureaucracy and the red tape, they closed hospitals. We've opened them. They laid off nurses.
Shame.
We've hired them. You can go from one end of the riding to the other. Health centers, new hospitals, St. Joseph's Villa, the hospice. It's all making it easier for people to access health care.
That's 12-hour wait.
I mean, let's be clear. Yes, in Cornwall we closed the hospital, but we have a much better hospital system. You can't have two small hospitals that are inefficient. And that's what you got to look at. You've got to look at making the system efficient. There's no sense going in and sitting in a chair, because everybody's gone to the emergency room here and sat 8-10 hours. I was talking to somebody that had a heart issue, spent the whole day, when 8 o'clock in the morning, didn't get into a room till after midnight. That's what we're running into.
That's what your tax cuts have brought you, year after year after year.
We built buildings, but we don't have the facilities inside them to actually handle healthcare.